Good afternoon, everybody. Thank you so much for joining us in this breakout session. I'm Tsipiso Makwetla, your facilitator for this exciting discussion. It really is going to be, we'll be discussing strengthening multi-stakeholder platforms for social accountability in our panel discussion. And we have not only an amazing panel, but we have a great keynote address as well. So first things first, we're broadcasting in English and Spanish translation. So look at the bottom of your Zoom app, you should see a globe icon. Please make your language preference now, whether it's English or Spanish. Mil gracias por su participación. I hope that I said that correctly. So we're taking live questions as well. So if you wish to pose your question to the panel, use the Q&A function for your questions. Also, please pose very clearly who you are, where you're from, and to whom in particular you'd like to pose your question. You can indicate that you want to pose a question live by raising your hand as participant as well. Secondly, you should have realized as you joined in that we're running a poll. You'll see on your screen there are 3 questions. Do you believe that multi-stakeholder initiatives work? On COVID, we're asking you, what sector needs to do more? Now, please send in those answers to those questions as soon as possible, because we'd really like our panelists to be able to answer these questions honestly and make sure that we put some fire under them. What do you think? So I'm answering the question already. I see it's popped up. Do you believe multi-stakeholder initiatives work? I'm answering. Okay, so you can do the same. So now let's get straight to it. Also, the event managers will advise you on how to get back to the plenary in case you're not sure on how to do that. But the Springboard to our discussions is a context of where we are and why. Our first speaker is Dr. Auxerius Barbeau. She's a physician, public health practitioner, innovative leader at the intersection of public health care and healthcare delivery. Her commitment to social justice is a common thread through her career in advocating for health equity, children's well-being, and community health. And I think that's been very much seen through her work. She's currently adjunct assistant professor at Columbia University Mailman School of Public Health and senior fellow for public health and social justice at the JPB Foundation. So as health commissioner for New York City, Dr. Barbeau was very instrumental in directing the city's response in the first wave of the coronavirus pandemic, a very tough time. Her actions, by taking science-informed actions, she helped save thousands of lives and made New York City's COVID response a model for the world. Dr. Barbeau received her BA from Yale University and MD from the University of Medicine and Dentistry of New Jersey. I don't have to give you all of that. She is very well accomplished. So Dr. Barbeau, if I could please give you 3 minutes. I know we promised you 5, but because of the delay, could I give you 3 minutes to just set out the scene for us?
Absolutely. Thank you very much. It's really my privilege to set the scene for the critical importance of centering communities in the ongoing response to this ravenous pandemic. So globally, there are about 69.3 million cases of COVID with over 1.5 million deaths. We know that virtually every part of the globe has been affected, though some countries to a greater extent than others. And for many countries, they are at a similar peak as they were at the very beginning of the pandemic. And while vaccines are on the verge of being approved or have just been approved, they are a long way off. So all of this to say that across the globe, COVID has laid bare the longstanding inequities in housing, health, economics, education, food systems, just to name a few sectors, and that the direct and indirect effects of COVID have been borne by women and the elderly especially, and that these inequities are societal vulnerabilities that have been exploited by this virus to further ravage already under-resourced communities. So in New York City in March of 2020, we became the epicenter of the pandemic. And very quickly it became apparent that our communities, our Black and Brown communities, were being disproportionately affected. Had nothing to do with race, because after all, race is a socio-political construct, but everything to do with the ways in which societal inequities get played out on the backs of the most marginalized communities, especially during crises. And so as part of our comprehensive response to COVID, we, through the health department, mobilized an equity action plan that engaged multi-sector representation to direct additional resources to the 28 communities that accounted for more than half of the COVID deaths. Through this partnership, we focused on three primary things. One was more robust dissemination of prevention messages through anchor institutions that are trusted community voices. We worked on strengthening the social services sector to ensure housing stability and access to food were not barriers to safe isolation and quarantine. And then thirdly, we worked on supporting the private sector primary care practices to provide ongoing physical and mental health in their communities. And this was essential because people were foregoing care for chronic illnesses because of fears of contracting the virus if they went to medical facilities, along with lack of health insurance and mistrust of receiving proper medical care. And so this advisory board provided a table whereby government and civil society partners could work through problems before us in a manner that centered on meeting the needs of communities most affected, created mutual accountability, and focused not only on the short term, but set the groundwork for what was needed to be prioritized in the post-COVID rebuild. And so COVID crisis teaches us that government needs community as much as community needs government. And that in order for these mutual dependencies to be fruitful, we must more fully operationalize a rights-based approach to collaboration so that we can materialize health systems that are designed around health as a human right and not a privilege based on privilege. And that achieving equity requires intentionality that centers resources on communities most affected, uses available data for advocacy, and leverages policy for action to save lives and alleviate human suffering. And so the challenge for all of us is to continue working with the same intensity to fully realize these goals even after the pandemic subsides, so that we can live in a more just and equitable world. So thank you for this opportunity to share this message.
Thank you so much, Dr. Barbo. I mean, quite a lot to chew on there, and I don't want to recap because it's still fresh on everybody's minds. So we'll do that when we get to the panel discussion. But I want to see if we can pull up then the poll results. Remember, we began by asking you these questions. Okay, so do you believe multi-stakeholder initiatives work? The results are 20.91% say yes, and 2.9% say no. So let's see if we can have then the next response to accountability, more on the front of what sector needs to do more, step up their actions and commitments. So the question whether it was the public health sector, the private sector, government, public sector, civil society, youth, academia, none of the above. So, okay, so we haven't got the results for that as yet, but we'll see if we can get a response out of you in the panel discussions. And we've also been asking you to please let us know who you are. The IT team can just bring up the results again later on, but let's get to the crux of the discussion. The importance of the discussion, of course, is to see how we can strengthen the links between social accountability, social inclusion, social resilience, empowerment, including synergies with community-driven development. And I think Dr. Barbo has said quite a lot about that. Let me introduce the panelists. Dr. Barbo, as you gathered, is an activist whose emphasis is on prioritized communication with New Yorkers. She did that with candor and empathy, providing trustworthy information and with reliable leadership. her story is well documented, and I read that according to, the various routes on her. I'm introducing now Ms. Evelyn Carrillo. She's a global health specialist and strong advocate of leadership for the youth, especially for young women in Africa. She was recently awarded the Top 35 Under 35 Kenya Award, and she has also placed in leadership in her role in the health sector, focusing on women, adolescents, and youth. She's a project director at Y Act, Youth in Action at Amref Health Africa. So we're going to hear her account of how they have or not been given space to play their role in this. And the next panelist I introduce is young William Schachrond of Royal Philips, currently serves as Vice President of Global Government and Public Affairs at Royal Philips, where he heads up the global network within Philips that are responsible for relations with government and related stakeholders to address societal challenges, in particular in the area of large-scale healthcare transformations. So in his role of partnerships with the United Nations and international donors, he focuses on strengthening health systems to achieve universal health coverage. Mr. Schachrond is also a former board member of PMNCH, member of GFF, and chairman of the UN Global Compact. So there's no doubt that we have the right panel to answer this question. So Dr. Barber, I'll start with you. My first question is, do you think government actions have limited the value in problem solving? And I'm talking about, you get the insightful account, very complex, of how governance works within the pandemic. But you yourself ultimately quit your job as health commissioner in New York. Was it because of that, the limiting nature of government's actions in dealing with an emergency such as this?
I think the important thing to focus on is the degree to which this emergency mobilized various sectors within the city to act with urgency and synergy. And, when that is working at its most harmonious, it's independent of one particular leader or another. And so that's really the importance, I think, of the approach that we took, that it was a collaborative endeavor that had leadership from multiple sectors that could equally rise to the occasion and to the challenge of bringing together resources.
And I understand how deftly you sidestepped that question, because what I'm really asking is, what are the hindrances? I mean, part of what was out there was that you felt that as a health department, your expertise as scientists were not really well relied on. And but some actions, had they been taken sooner, could have saved many more lives. And I'm talking here about the issue of contact tracing, the issue of PPE, whom it was given to and who was fighting over it. And it is about this multi-stakeholder partnership. Where were the problems? How do we, highlight what the blind spots are?
I think the importance of having a multi-stakeholder collaboration and body that can work with various sectors within government is that when there is delay in action at the highest levels, that there then can be pressure imposed by various aspects of civil society to get to the final sort of piece that needs to be put in place, right? So when there are technical decisions to be made, when there are decisions to be made that affect the broader society, it's not just about the voices inside of government calling for actions to be taken, but it's doing it in collaboration with community partners, with leaders in the religious community and the economic business community, to all be singing off the same song sheet. And I think very much that ended up happening here in New York, and we got to where we needed to be.
Okay, thank you very much, Ms. Carrillo. Let me come to you. Just given what Dr. Barber was saying, it's also about impact, but do you think some of the actions that governments took were limiting in the ability of civil society to be able to be vocal about their experiences of COVID-19, how they were affected, and for them to be able to gain resources? And were you enabled, as in, did you have agency to be at the forefront of some of the better solutions? Ms. Karija.
Thank you, Tsepiso. Very exciting conversation, and I think it's coming at a very important time when the world is working towards recovery during this time of the pandemic, but also at a time when we're really acknowledging the power of social participation and multi-stakeholder approach, really for inclusive, responsive, and recovery strategies. More importantly, over the last decade, we've really seen the power of civil society and the fact that they really bring a lot to the table. And of course, the constituency that I represent, the 1.2 billion strong young people. And this has really been a curveball that no one has anticipated. But then when I look at what governments have done and what civil society and other stakeholders have done, I can say that we have been given a space to participate and to really contribute to social participation. And looking at UHC 2030, the fact that civil society really put out a strong call for multi-stakeholder action for the achievement of UHC. So right now we're looking at recovery for COVID-19. We're wondering, have we been given space as young people, as civil society, to really participate at this time? The answer is yes, we have, although a lot needs to be done. One, in terms of ensuring that we have a paradigm shift where really the power of decision-making is on citizens who have access to and whose right is to access healthcare. But also we need inclusivity. We need to ensure that we don't leave the most marginalized populations when it comes to decision-making and to social participation. We also need to break barriers for civil society and for the youth to be able to participate effectively, not just in social participation, but also in accountability. We need to make sure that they're able to have resources, the skills, and the tools that they need to participate effectively. Here in Kenya and in East Africa, I'd say that civil society and the youth have risen up to the challenge. We've also seen a lot of multi-stakeholder collaboration. For example, civil society, private sector, and the government work together to collaborate and innovate the Wheels for Life initiative, which then ensured that expectant mothers to access services even during the movement restriction period. That really showed the power of multi-stakeholder.
So, Ms. Karija, I am going to interrupt you because we have limited time. You have spoken about the need for platforms for youth participation. You, as AMREF, I believe, have some sort of partnership with Philips. So talk about whether or not it all just boils down to financial support, or has there been greater socioeconomic support that is non-financial, mentorship, empowerment of a means that will sustain you in the long term? And what has been the price of that? Would you have had to change your tune on things that you would be critical of private sector for you to be part of that?
But yes, as you've mentioned, we have a really great partnership with Philips, and not just Philips, quite a number of private sector players. And when it comes to public-private partnerships, we really don't compromise on the values and the needs of communities. We prioritize to ensure that there's affordable prices, but also ensuring that the most marginalized communities are involved in the design of these public-private partnerships. So for example, in Kenya, we have partnered with Philips, as you've rightly put it. We've been piloting a program in the lower eastern regions of Kenya, in one of the most marginalized regions, to really ensure that communities have access to healthcare and to ensure that health workers have the appropriate skills to provide services to communities. So we don't compromise on anything. We put our communities at the heart of what we do, ensuring that they are the priority and that they're involved in design, implementation, and accountability. Over.
All right, thank you very much, Ms. Karijo. Mr. Shakron, so now it is your turn. And I would like you to please tell us how Philips has encouraged a sustainable and ethical social contract. And I'm talking about here, not coming in with a big brother philanthropic hat. How have you addressed the needs of communities in African countries that you've offered technical solutions? And are you confident that all of them will not contradict, that you have being true to that social contract that you've proposed? Because Karijo here says you have, but are you sure all the communities that you're involved in can really say that?
Well, that's a very difficult question, because you're asking us more or less if we have created world peace in Africa, and if everybody agrees. Look, I think we start out with a responsibility, a purpose to improve the lives of people, and also those that are left behind. And in fact, we set ourselves a mission to improve the lives of 300 million people in underserved communities. Now, the private sector is not very good at talking to underserved communities. And in fact, a lot of the private sector will say that communities or underserved communities are probably a bad investment. But given our purpose that we are, I think, credible on that towards our own employees, our partners, and also to our customers, we've said we need to make this work. And so when we started to look at how do we make this work, how do we transform primary healthcare or access to care in the lowest resource settings and contributing to UHC, we could see where our strengths are, innovation and technology, of course, but we can also see where our weaknesses are. So, if we as Philips would go into the communities in Africa and tell them, hey, we're here to help Irving Philips, nobody's going to believe us.
So what would you say are the weaknesses? I mean, you've spoken about the trust deficit.
Yeah.
And there has been, and allow me to just use this example from my country in South Africa. When we look at COVID management, it's alleged that the companies that have made the largest donations have been the ones who've reaped the greatest rewards, getting the best tenders, the biggest tenders in,
right.
COVID-19 emergency resources. So,
yeah, so we don't do donations as Philips. We have created a foundation to do that completely separate, and they are not allowed to have any commercial links, and I think we shouldn't have. But in terms of transparency and the importance of transparency and building trust, it's really important that as a private sector party, you let go of some of your control, you're open about your intentions, and that you understand where you have a role to help co-create and co-design solutions that help society. And then also know that when somebody's going to take a commercial decision, like a government is going to issue a tender, that they step back and that they take all the wisdom from the world, and then they go and issue the tender. You have to fight for it, despite everything you've done before. And that is a way of working for large-scale transformation that is difficult for people to understand, because on the one hand side, you want to talk to private sector, NGOs, academics, everybody to co-create how does the new world have to look like. Why is that important? Well, COVID has just taught us that. Because what happened with COVID, we have a crisis, nobody knows how to do with crisis, and suddenly everybody works together. We were working with governments, and our competitors were working with us. We were talking to each other as competitors. How can we help? How can all in line with competition law, of course, but we're all trying to team up with patients, with doctors on how to solve this, just like what Dr. Barbeau said about New York. And that momentum of collaborating and working together is suddenly lost when we talk about UHC again. Because let's not forget, when we talk about multi-stakeholder partnerships, everybody says, yes, it works, but everybody also know, yeah, these are slow and complex and they never deliver anything. And in COVID, we suddenly had multi-stakeholder partnership in a pressure cooker delivering really fast. So how do you keep that momentum and now translate that to UHC, leaving no one behind? So that's where you need neutral brokerage, because during a crisis like we just had in COVID, everybody's now going to think about, was everything done the right way? Was the right intention and the right governance? The right intention, I believe most, yes. The right governance, probably no. So the right governance can be strengthened, if you don't know how to do it, by having an independent broker, by having a trusted advisor, by having your biggest adversaries, your biggest criticasters in the team. It's better to have them in the team than have them complaining afterwards. Because a company like Philips cannot say afterwards is, oh yeah, sorry, we forgot to do that, and we'll just create more trouble because people remember. People, if you have a reputation for 120 years as Philips, you're not going to waste that by excluding certain parties.
No. Before I go to the questions, I do have a question here, and I'm not sure if it's being offered to be asked live, but I'll establish that in just a moment. Dr. Barber, before we go to those questions, I saw at some point you were smiling. Are you in agreement with what Mr. Shachroth is saying? Has that been borne out in the partnership modalities that you had in New York and fighting the pandemic? Has there been a real shift?
I couldn't agree more that the partnerships that we formed during these crises have demonstrated what is possible. And I agree even more that the challenge will be maintaining that urgency and being transparent about what barriers, what potential bureaucracies can actually be done away with moving forward. Because if we could do it in the time of COVID, there's no reason why we can't do it moving forward. And that really, I think, will require many partners to look at what their positions have been and be more transparent about what power can be given to the collective as opposed to maintained for that entity. We're in a transformative period. It's very exciting.
And I want us to talk about that because they say frameworks have limits. Recent evidence has shown that often social accountability mechanisms are isolated, particularly from public sector processes, that they're not effective as collaborative governance. But let me just go to this question. It's from Anonymous. The question is, how can CSOs engage better with private sector and government, but not be tokenized? So I'm going to ask you that difficult question, Ms. Carrillo.
Very interesting question. We get that a lot, especially for us young people within the civil society space. How do we engage with other sectors, private sector, governments, and really ensuring that we go beyond token collaboration is meaningful? The first one, of course, is really accepting and acknowledging the contribution that civil society brings to the table. Once we acknowledge that with civil society and with movements, the outcomes are much better than having a single partner on the table, then that becomes the first step of ensuring that we do away with tokenism. The second one is ensuring that all stakeholders, including civil society, have the right skills and tools and resources to participate and collaborate.
Ms. Carrillo, just allow me to, so if you're saying do away with tokenism, is that then an admission that it does exist in these multi-stakeholder partnerships for people to be able, especially civil society, to be able to get their agenda across and to have their demands at least addressed?
I would be lying if I said it doesn't exist. We know tokenism does exist. I think acknowledging that and being aware and really being deliberate about ensuring that we do away with tokenism is the first step to making sure that our collaboration and engagement is meaningful. So yes, it does exist. And before you interrupted me, I was talking about skills and tools and resources and the fact that civil society need this to be able to participate and collaborate effectively. Then that becomes a really powerful weapon of ensuring that we're not just ticking a box that civil society or other partners are involved, but there's really true and meaningful participation and collaboration. And then, of course, acknowledging and accepting the rights that we have. So knowing that as civil society and other stakeholders, it's our right to participate, to collaborate with governments and with other partners, then that also becomes a powerful tool in doing away with tokenism. Over.
All right, thank you, Ms. Carrillo. We have a 5-minute warning. I see that came in literally quite 3 minutes ago. let's open up for live questions. If anybody has a question they want to ask live, please raise your hand in the participant group. If not, I'm just going to go through the questions that are already here. So anybody, I'm going to ask the technical team to unmute anybody who would like to ask their questions live, because I see I'm struggling to get mine. Okay, so far there's nobody. So let me go to what we have here. Okay. Hello, my name is Suvik Pain, and youth advocate from India. I have one question, not specific to any panelists. Anyone can take it. Can you share some good practices and examples where the accountability mechanisms within multi-stakeholder structures have worked successfully? What were the success factors? I think this is a good one for you, Mr. Shaikhron. You've done work in Congo Brazzaville and in Kenya. So what were the machinations that were a hindrance, and how were you able to overcome them?
Yeah, so one of the things that we did in Congo Brazzaville is that we created a partnership with the UNFPA, Maternal Newborn Child Health, who's the trusted advisor of the governments, and who aligned with us on the need to improve maternal newborn child health. And of course, as Philips, we are a health tech company, have competencies in that space, and we want to be meaningful in that space. The Congo Brazzaville government wanted to engage with the private sector to actually innovate and disrupt the healthcare system in Congo Brazzaville and become more sustainable financially and clinically better. But of course, for a government to engage with one company or a few companies, there's always this power balance or this difference in knowledge. So it's very difficult if there's this disbalance that somebody's not going to take advantage of that. So UNFPA has taken the role of being a neutral broker and bringing everybody together. So the entire UN system, the local NGOs, making sure that every citizen is being heard, and then facilitating the government to come to a solution for transforming the health system, which will then eventually will need to turn into a project. And we dedicated our resources, but we also have the agreement with UNFPA that there's no responsibility or obligation from UNFPA towards us. They need to be absolutely seen as a neutral broker. They need to be able to perform that role, and it also means that they have to be able to turn around to Philips and say, "Thank you very much for joining. It wasn't good enough. Go somewhere else."
Okay.
And only on that basis can you, and with every stakeholder, that must be clear. So you need to understand each other's intentions. We had a common purpose that we were all working towards, improving UHC through innovation. But then not everybody will be able to live up to that. We hope we can. And you need to have a neutral broker that's able to tell people you're no longer good enough, or we need somebody else there. And the UNFPA is performing that function.
Okay, thank you very much, Mr. Shaikhron. We've got Judy Koryatsky who would like to ask a question live. Judy? Hi, Judy, I see you've got a raised hand there. Are you? Okay, thanks. Go ahead. Oh, I thought I heard Judy. Have you disappeared on me?
I'd like to hear more about the partnership of civil society and government and private sector, because we know the PPPs are only what's going to reach health for all. And it's delightful that Philips is participating in this. And so as part of the Health in the Hands platform that we've done with the UAE SDGs in Action campaign, I'd like to hear Jan talk more about how we can escalate and scale these.
Thank you, Judy. Mr. Shaikhron?
Yeah, and so maybe important to say that in our partnership with AMREF in Kenya, for example, AMREF is the lead. So they are our boss, and that helps because that means that accountability is there first. And what we've done is we are trying to document what we do in Congo and in Kenya and how it works. And happy to share all the lessons. But the other thing that we're doing is for these transformations to be sustainable, also financially and investable for an investment community, we need to unlock more money. And so what we've done is we've also put this way of working into an investment case and asked investors, social entrepreneurs, donors philanthropists to see, would you invest in this transformation, and do you think this is real shared value? So opening it up to the entire investment community. And I think that is probably the best test of whether this public-private collaboration would work in practice, because it is only sensible, it only makes sense if we found a way to replicate it and invest at scale.
Okay, so I've got a question here from Rosanna Lescrawet. I hope please apologies in advance if I can't pronounce it correctly. I feel terrible already, Rosanna. The question I'm going to pose to you, Dr. Barbeau, she's asking, what ways can we develop and set up mutual accountability systems that are sustainable and manageable? And I'd like us to borrow from the HIV/AIDS pandemic and how we squandered some of those multi-party partnerships because they promised very far and they didn't really deliver.
So my experience, having worked in more than one health department in the United States, is that the sustainability of partnerships is dependent on the commitment not only of people within government, but also obviously within community. And though it's important to have commitment from the leader, let's say, for example, of the health department, it's as important, if not more important, to ensure that there is what I like to call a bench, meaning depth in middle management that will continue that institutional commitment to ensure that resources and opportunities are maintained for ongoing collaboration and contributions to governance. Because I think it's very easy for systems to default into the ways in which they have formerly functioned, and that true partnerships, so the true sustainability requires ongoing intentionality and recalibration about what the needs are of the moment.
Thank you, Dr. Barbeau. Eliana Montefort is asking, one of the biggest challenges for multi-stakeholder panels is aligning various stakeholders with sometimes very different wants, needs, and realities, and one mission and one vision. How can these platforms ensure effectiveness while also meeting the needs of all their stakeholders, especially when stakeholders have conflicting views? And I think, Ms. Carrillo, you're very well off to answer this question. What I was saying earlier on, that frameworks have limitations. So for your constituency, what would be important at this point? Obviously, you suffered a lot from a loss of jobs, sexual and reproductive health rights, apparently lack of services there. But this is a generation with its own needs, skills development, especially in the era of digitization. How do you navigate all of this, as Eliana has said?
Great question from Eliana, who leads our CSEM. And I agree with you. Our constituency, especially the young people, we are really affected. Even before COVID-19, our health status, our access to economic opportunities was limited. As you rightly put it, HIV incidence really high among adolescents, cases of teenage pregnancies. Unemployment, for example, in our country is about 30% for young people. So really a dire situation. However, what I'm really proud of is that our constituency and the young people have risen to the challenge, have shown that they are a force to reckon with at this time. For example, during the pandemic, we've seen young people partnering with other stakeholders to really innovate and come up with solutions to help our economies recover and even respond to the pandemic. For example, here in East Africa, we had the youth innovating the very first mechanical ventilator, and the government provided the needed regulations to ensure that these ventilators were taken up by the markets. So collaboration is there. What I've realized is that for young people to be taken seriously and for these collaboration frameworks to work, we have to rise up to the challenge. We don't have to wait for opportunities to be given to us on a silver platter. So putting ourselves out there, showing the prowess that we have, and then governments and other stakeholders can acknowledge our potential and really ensure that we collaborate effectively. Over.
All right, thank you very much, Ms. Karija. And unfortunately, it seems that we have run out of time, but I think there's a lot that has come out of this. There is a need for modernization of systems as multi-purpose data hubs as well. I've heard, and it's been said, are key to not only creating jobs that fit the aspirations and capacities of African youth, but just also having cross-sector, cross-border partnerships, interventions that will build a direct response to COVID-19. They're already at play, but they need to address broader challenges related to food security, nutrition, climate change. That has also been expressed very forcefully. Thank you very much to the panelists. It has been a great panel discussion. Unfortunately, wish we had more time. Dr. Auxerius Barbeau, thank you very much. Ms. Evelyn Carrijo, thank you very much. Jan Willem Schachron, thank you very much. And I hope to those who joined the session that it was worthwhile and you managed to glean something of what the challenges are and what the way ahead is in trying to resolve it.